Individual behavior, and indeed the collective behavior along with incentives, shape our actual health and our health policies. So, within this context of a complex subject that hinges on the vagaries and nuances of individual and societal behavior, I have written 18 essays. Each essay is its own sketch of a topic that is, in my view, critical to better understanding the present-day complexities of healthcare. While there is some calculated and purposeful overlap between the essays and their topics, the stark differences among the topics is also intentional. Because, as actors within the larger healthcare ecosystem, we are also all different. Therefore, our experience with health and healthcare, which shapes our viewpoint and perspective, is naturally different too. I hope in listening to these essays that you recognize an experience from your own life. 1. All the King's Men. The end of man is knowledge, but there is one thing he can't know. He can't know whether knowledge will save him or kill him. He will be killed all right, but he can't know whether he is killed because of the knowledge which he has got, or because of the knowledge which he hasn't got, and which, if he had it, would save him. Robert Penn Warren, All the King's Men. Imagine if you were Martin Shkreli, not the being sent to prison part, not the buying a rare $2 million Wu-Tang Clan album part either, but the part where you were easily one of the top 10 most hated business people in the country for 3 years running. Now imagine that everyone in the country also owed you a collective thank you. It's a rare occurrence indeed that someone can be so repulsive, yet we are so much in debt for the light he has shown on an issue. Shkreli is not alone. We can thank Heather Bresch, Brent Saunders, and while we're at it, Gilead Pharmaceuticals as well, and countless others. Let's be clear, we have known for decades that pharma prices made no sense. Professor Uwe Reinhardt of Princeton University and Professor Gerard Anderson of Johns Hopkins University told us as much in their landmark article, It's the Prices, Stupid, published in 2003, which looked at the latest data from the Organization for Economic Cooperation and Development to compare the health systems of the 30 member countries in 2000. The results? The United States spends more on health care than any other country. On most measures of health services use, however, the United States is below the OECD median. The authors suggest that the spending difference is because of variations in the prices of goods and services among countries. Despite this landmark academic article, nothing has ever happened. We could smell the rank odor of the pricing process, and we were able to bear witness to the ludicrous verbal gymnastics of those who attempted to explain the process, but the outrageous prices continued. Prices were there, but not really there. We thought about these things. It wasn't the type of thing that we spoke about, but rather the stuff of policy wonks and health economists who mixed in those circles. We complained, and we grumbled. But like our grousing about bank fees and the price of gas, it got lost in the noise and the never-ending conversation of how everything in life has gotten so expensive. Then September 2015 happened. Martin Shkreli and Turing Pharmaceuticals obtained the manufacturing license for the anti-parasitic drug Daraprim and raised its price by a factor of 56, from $13.50 U.S. to $750 per pill. Only 2,000 Americans use Daraprim every year, and while toxoplasmosis affects an estimated 22.5% of Americans over the age of 12, typically only people with immune systems weakened by HIV/AIDS, cancer treatment, organ transplants, or pregnancy need the medication. To dismiss these small numbers relative to some larger and more common diseases such as cardiovascular disease, diabetes, and respiratory illnesses would be to miss the point. The world gasped. How could he? Hands started wringing everywhere. Talk shows and social media platforms were abuzz. No less than presidential candidate Hillary Clinton tweeted out about it and promised to address price gouging in the pharmaceutical industry. And because of this buzz, as Malcolm Gladwell would surely tell us, the tipping point had just occurred. The moment of critical mass, the threshold, the boiling point. It didn't take a major 60 Minutes expose or some hard-hitting undercover journalism from the New York Times. It didn't take